How much longer will my child have to wear a mask at school?
It's a question many of you have been asking now for almost 2 years. Tomorrow, Governors Dan McKee and Charlie Baker are scheduled to make announcements about masks. As of tonight, Rhode Island is among 15 states and Washington, D.C. that currently have K-12 mask mandates. Parents have taken notice and many sounded off during a Rhode Island Department of Education meeting tonight. 12 News reporter Sheena Losciuto shares both sides of the argument, which is new tonight.
Well, masks have really been required at Rhode Island schools since students were allowed back in person. Since then, many students have been vaccinated, but the state also saw another big surge. These were all points brought up at that meeting. We're hearing from educators.
As a teacher, I'm far less worried about myself than I am for my students and for my son.
Parents.
Let those who wish to be masked stay masked, and let those who wish to breathe air freely do so.
And even students.
From what I've seen at Charahoe, most students wear their masks out of force, not fear.
Dozens shared their take on the universal school mask mandate at Tuesday night's Council on Elementary and Secondary Education meeting. Last week, Governor McKee extended the executive order requiring masks in school until at least Valentine's Day. After that, it could only continue if the full General Assembly votes to let him keep it in place. That vote is expected Thursday.
I think masking is still required. My son, although he is in first grade, says that he wishes he could see people's faces. He feels safe with his mask on because he believes that it's helping to protect him and others from the spread of COVID. I understand that there is a desire for the removal of masks because it does have impacts. I don't want to deny that, but I think that we need to think about the fact that not all of our classrooms have adequate ventilation.
Meanwhile, the people behind the lawsuit fighting the initial mask mandate continue their battle. Lead plaintiff Richard Southwell says he's been homeschooling his son this year solely because of the mask mandate.
So what happens if the masks go away, hypothetically on Monday? We continue the lawsuit because, we lost the injunction, which was to get the masks off the kids while the case was being tried. That didn't happen. Now we're in trial. But we need to get an answer from the courts as to whether or not the things that have happened were actually legal.
We'll be streaming both governor press briefings tomorrow on WPRI.com. So are there any clues right now as to when masks will be a thing of the past in general? 12 News reporter Kim Kalunian continues our coverage with what one expert is saying tonight.
Well, the dean of Brown University's School of Public Health says he doesn't think mask wearing should go on forever, but he also thinks that there should be specific metrics that are taken into consideration when deciding to end the mask mandate.
It's been very controversial, and I think unnecessarily so.
Dr. Ashish Jha addressing the polarizing topic head-on Tuesday in a virtual forum at the Providence Public Library, saying he's been a proponent of school mask mandates since the onset of the pandemic. He says the data shows masks help, though he concedes they are not a slam dunk.
Are there costs? There probably are. Are they massive? Probably not. People are convinced that somehow masking is going to turn our children into sort of unable to learn languages. I think they're a little bit more resilient than that. That said, I do not believe we should be masking forever.
So what now? Jha says in highly vaccinated communities where infection numbers are low, it's reasonable to remove mask mandates, but he thinks testing, ventilation, and other mitigation practices should remain.
In communities with very low levels of vaccinations, it's just riskier. Take the mask mandates off, you're going to see more spread.
Jha says he's been disappointed by the slow uptake of vaccines among kids and teens nationally. Rhode Island Department of Health data shows 67% of 15 to 18-year-olds in Rhode Island are fully vaccinated, as are 55% of 10 to 14-year-olds and 15% of 0 to 9-year-olds. Meanwhile, Rhode Island's transmission rate remains high, though cases and hospital admissions continue to decline. Jha summed up his thoughts on masks in schools like this.
They help. They're not the end-all be-all. They're not horrible. We should use them when we can. We should mandate it judiciously, and we should be okay with dropping them when infection numbers are down and vaccinations are up.
And when it comes to kids getting the vaccine, Jha recommends the shot. He says the data shows that the risks of COVID to children are small but real, while the risks of the vaccine are tiny. In the studio, I'm Kim Kalunian, 12 News.